Hi, my name is Alejandro Delek. I am going to talk about risk factor for patellofemoral pain syndrome. Definition. Patellofemoral syndrome is characterized by insidious anterior kid pain caused by friction of the cartilage overlaying the patella against the femur and tibia. Risk factors. Muscular factors. Quadricep weakness, diffusion of the iliotibial band, weakness of the hip musculature, factor associated with training, inadequate footwear, uneven training surface, and poor load managed in training sessions. Biomechanical factors, excessive internal rotation of the femur, kinetic valgus, poor gait biomechanics.
Patellofemoral syndrome is a very common entity. It's probably the most common overuse condition that we see in the knee. And generally, people present with what we refer to as anterior knee-related pain, which is pain in the front of the knee. If we were to look at the design of the knee, there are basically three bones. There's your femur, which is your thigh bone, the tibia, which is your shin bone, and then there's the patella, which is the kneecap. So with physical activity, the patella is pulled up and down and up and down, up and down as we run. And if the kneecap stays in the middle of that groove, it's pulled up and down without any problem. If the kneecap is deviated to one side or the other, the cartilage on the back of the kneecap tends to get inflamed. The back of the kneecap is a perfectly white, smooth, shiny surface. If you look inside the knee joint, it looks like a cue ball. It's absolutely beautiful. The end of the thigh bone has that same material. In patellofemoral syndrome, people's kneecap are aligned one way or the other, so they're bearing weight primarily on one part of the kneecap than the other. So if they do a lot of repetitive activity, one part of the kneecap is working overtime and the other part of the kneecap is taking the day off. And essentially we'll start to develop an inflammation behind the patella and inflammation on the end of the thigh bone. If they have a flat foot, we'll often put them in an arch support to neutralize the alignment of the foot. More than anything, it's really a matter of retoning their quadricep. There are four muscles that control your kneecap. There's one muscle on the inside, one muscle on the outside. The muscle on the outside is generally a little bit too tight. The muscle on the inside is a little bit weak or atrophic. If we can strengthen the muscle on the inside of the knee and work on the flexibility of the muscle on the outside of the knee, we can kind of balance that kneecap, allow that kneecap to ride in the groove that it's supposed to, and the inflammation will go away. So part of it's rehab. Acutely when they have pain, icing is important. Acutely, an anti-inflammatory like Advil or ibuprofen is often helpful. But in the long term, if they want to be involved in an exercise program, it really involves balancing the mechanics of their knee and it involves optimizing the alignment of their foot. If they continue to be active, because one part of the kneecap is bearing more weight than it should, we will see some breakdown of that articular cartilage on the back of the patella, and we will see potentially the development of arthritis down the road, where that white, smooth, shiny surface wears away. So it is important to get it treated, and not only to lead an active lifestyle, but also to prevent arthritis. In some cases, we do surgical intervention. It's not common, but I would probably say 1 out of 50 or 1 out of 100 people, we might end up doing an arthroscopy and smoothing down the back of the kneecap, or we might end up doing a procedure to manually reposition the kneecap so that the kneecap will, in fact, stay in the middle of the groove.
Application of the physical therapy. The goals of treatment are to reduce pain and swelling, recovery of the kidney fusion, replacement of the patella and muscle extremities. Patellofemoral rehabilitation should focus on recurrent of the vastus medial obliquus, normalization of the patellar mobility, increasing overall flexibility, and muscle control of the interior lower extremity.
Hi everyone, Nathan Mobbs here from Personal Best Physiotherapy in Wodonga. In today's video, we're going to show you 3 great exercises for patellofemoral pain. Patellofemoral pain is pain that is felt in the front of the knee, in or around the kneecap. When patients have patellofemoral pain, they will often have difficulty doing certain activities such as going up and down stairs, bending, squatting, or playing sport. Patellofemoral pain affects patients of various ages. Without treatment, this problem can often continue for a very long time, and patients will describe ongoing pain, disability, or trouble using their knee. At our practice, we have a comprehensive approach to treating patellofemoral pain, and part of this is doing specific exercises matched to your stage of recovery. It's important to remember that this video will give you a guide as to some of the exercises that we use, but we strongly recommend that if you have this sort of knee problem, that you have a thorough assessment by an experienced physiotherapist to work out exactly what you need to do. Okay, let's get started.
For this first exercise, we're trying to get your quadricep muscles going during the early part of your rehab. You start by putting the hands on the inside and outside of your thigh so you can feel the muscle turning on. You then practice pushing your knee down into the bed or pulling your kneecap up to turn on that muscle. You then hold for 5 seconds and repeat it 5 times. So for this second exercise, you need to attach a black piece of band to a pole or a sturdy table leg and then loop it around to the back of your knee. You should step out so there's a bit of stretch on the band and you can feel the pull. You start with your knee bent, your foot must stay flat on the floor and your body nice and straight, and then you straighten out your knee, you hold for 5 seconds, and then you slowly let it bend forwards. This should be a nice controlled and slow movement. When you're straightening out your knee, you can also pull your kneecap up to try and get your quads working a little bit harder. For this third and final exercise, you need to stand on your injured leg and come to the side of the step. You then push off to straighten your leg into your start position. You are then slowly bending your knee and then straightening back up, making sure this foot doesn't rest on the ground, it should hover above. You can hold on to the wall if needed for balance.
So there you have it, 3 great exercises for patellofemoral pain. Based on the video, if this looks like the sort of knee problem that you have, please give us a call at our physiotherapy practice on 6056 6616. If you're looking for information or useful tips on other problems, like low back pain and sciatica, hip problem or a shoulder pain, then please have a look at one of our other videos or go to our website, which is personalbestphysiotherapy.com.au. Remember to give us a thumbs up like if you enjoyed this video and subscribe to our YouTube channel. And until next time, keep active.
Pros and cons. Pros: decreases pain, reducing inflammation, muscle strengthening, painting on regain key function. Cons: current physical therapeutic intervention has no contraindication for the patient. Statistics in Ecuador. This pathology is very frequent in runners and young people. However, the incidence and prevalence is 2 to 3 times higher in women compared to men. This significant data is due to the biomechanical difference between genders. Conclusion: patellofemoral syndrome is one of the most frequent pathologies of the hip joint, producing discomfort or dull pain around or behind the Kit Kat. Is a fairly common condition among young people and adults, related to overhead imbalance of the extensor muscle and problem in the position of the Kit Kat.